All right. Hello and welcome. My name is Kathleen Morgan. I'm with Lawrence Public Library, and I'm here with Laurel Lewis, our esteemed retroactive, I almost said retirement boot camp, but retroactive leader. Thank you for being here today to talk about navigating the healthcare marketplace, which is often kind of a confusing undertaking. And we're going to help you kind of learn more about that website and how you can sign up for healthcare. This class is focused for folks that might or not quite Medicare age. The Medicare or the marketplace coverage is for folks that up until they're eligible for Medicare at age 65. So I want to first thank our sponsor for retroactive, Capital Federal Savings. They've been a fabulous partner for many, many years. If you are a customer of CapFed, and just be sure to say thank you for all they do for retirees in this community.
Yes.
And also thanks to the Katzmans, Sharon and David Katzman, who have created a fund to supplement this program as well. So we're really, really grateful and lucky to have such great support for the retroactive program.
Right. And
So
I asked Kathleen to introduce Heather because they go back a long way. So
yes, and
I will let you.
there's my segue. Yeah, Heather and I have known each other since 2008. We have know each other through church. I am a member of Plymouth Congregational Church, and Heather was my spiritual advisor as one of the ministers at church. So she has had a long career helping people and helping folks in the community here in Lawrence and also Eudora. And she currently is a community engagement coordinator with Cover Kansas, which is a nonprofit that is specifically was started to help people get connected with the healthcare that they deserve, either through the healthcare marketplace or other channels. So with that, I'm going to turn it over to Heather and let her um, do her presentation. If you do have questions, there's a chat bubble at the bottom of your screen, and you can put it in there, or if you want to, raise your hand or unmute, we can take questions that way. But maybe we'll let Heather give her presentation and then we'll take questions afterwards. How's that sound?
Thank you.
All right.
Great. Thanks. Thank you both for that. And just I don't have the chat bubble. So Kathleen
Oh,
or Laurel, if either one of you see a question, just let me know and ask questions anytime. So
perfect.
thank you all for coming and being here. As Kathleen said, I am part of a group called Cover Kansas, which is a special project of Community Care Network of Kansas, which holds the consortium for all the federally qualified health centers around Kansas. We're a group that believes in healthcare for all, and for whole person healthcare, and helping folks find health insurance in the affordable marketplace is one piece of that. I'm going to go through my slides and can I go through them? I told Kathleen and Laurel this before. This organization is, as of a couple weeks ago, closing at the end of August because we are losing our federal funding, as many folks are right now doing this kind of work. But I want to tell you what we do, and I'm going to tell you how, even after we close our doors, that you'll still be able to get into the federal marketplace and find health insurance. So this is what we do now. So we are open through August 26th. So all of this, if you have any questions, you can contact us through August 26th and you will find someone. So we are a not-for-profit and we offer free, unbiased assistance for anyone in Kansas seeking healthcare coverage. There's also a Cover Missouri, a Cover Oklahoma, a Cover Nebraska. So it's a national organization split up by states, and we help folks find insurance in the marketplace. So I don't do Medicaid, I don't do Medicare. Medicare. We help the people with insurance. So we can also help you if you have you think you've been um, had fraud committed against you. We can also, if you come in and we're pretty sure when you qualify for Medicaid or Medicare. So if you call us, we'll let you know if you should be talking to somebody else. And we have a navigator over the phone you can call at any time, Monday through Friday, sort of 8:30 to 5. And we also have navigators at our clinics around the state of Kansas. So if you want to see someone in person, um, so Heartland Clinic here in Lawrence is one of the federally qualified health centers in the state, and I believe they are working on getting some navigators there. So navigators are folks who help you find insurance, but we do have navigators in Topeka and Wyandotte and Johnson County. So if you wanted to see someone in person, you could go there, and those navigators will be there even after August 26th. Um, so if you were to get insurance through the marketplace, and this sometimes people call it Obamacare. So these are the things you know. If you find an insurance policy in the marketplace, there's things you know will be covered. So outpatient care, emergency services, hospitalization, pregnancy, maternity, newborn care, um, mental health care, your any prescription drugs, so rehabilitative services, your labs, mental and physical health screenings, immunizations, and everyone gets a free annual physical every year. So those are things that you can be sure are there. So if you get health insurance outside of the marketplace, people don't necessarily have to offer that, but in the marketplace, if they qualify, if you find them in the exchange, you'll know that those things will be covered. They also cannot be in the marketplace if they don't cover pre-existing conditions. This was a big change in our country when the marketplace came on, that people used to be not able to find insurance if they had a pre-existing condition, but now people are guaranteed insurance. So, so all those things you'll know that they are in there before as you go in and start looking around. So who qualifies for the marketplace? Well, anyone can get insurance in the marketplace, but if you make between at least 100% of the federal poverty level up to 400% of the federal poverty level, there are tax credits that will help make your insurance more affordable. And so I have this graph up here. So across the top is your income, and this is household income. And then down the side, down this way is how many people in your household. So if you are a household of one, um, so if you make between $15,060 and $60,240 a year, there are tax credits available. So meaning that the price of insurance minus how much there are subsidies at to subtract the amount of the insurance. So folks in this area, it's up to 100. So down here across the bottom is what percentage of your income you will pay at different levels. So as you'll see, between 100 and 150% of the federal poverty level, that's what FPL is, it's free. So there's no tax or there's no pay for insurance. Those are very good policies. And then 2%, 4%, 8%, 6%, 8.5% as you go up. So one of the change, and I'm going to talk about today some of the changes that are happening, or if you got insurance today, what it would look like, and there's probably some changes coming next year. So what it might look like next year. So right now, it's as it's written, anyone making if you make a but you I'm sorry, you it won't let you pay more than 8.5% of your income. So even if you make more than 400% of the federal poverty level, so if you're at 405, 410, there's still subsidies that you'll only pay 8.5% of your income for health insurance. This is going to change. So, most likely. So this was a change. If you read the ACA, if you read the bill written into the bill, there are subsidies between 100 and 400%. In 2021, they started making the subsidies more, so going over 400%. So this is something that's going to expire this year, and it needs an act of Congress to make it keep going. So there's been no hint in Congress that that's going to keep going. So we're just for my purposes, I'm going to assume those are going to expire. But if you get insurance this year, this is what the numbers are. This is the percentage of your income that you'll pay for insurance in 2025. I'm gonna show you. So this is what these numbers right here are the numbers written into the Affordable Care Act, and these numbers right here are the numbers that have been since 2021. So you'll see this zero between 100 and 150% is right now. But after next year, if you get insurance after the end of this year, you'll start to pay a little bit or pay some if you're in that category. And there's going to be a whole big drop off for folks after 400%. So right now, people making 403% or 410% are still only paying 8.5%. Next year, there's going to be no subsidies unless something happens. So just to sort of be aware as you're looking at insurance, and a lot of projections I've seen have said that American seniors are the ones that are going to be, or some of the people going to be most affected by this, because they're people, early retirees, people not quite ready for Medicare yet, are the people who are making around that amount that are not covered by insurance through your employer. So and here's a graph. You can see how much this is how much the people signing up have grown in the Affordable Care Act. So it just keeps getting bigger and bigger and bigger with these subsidies. So last year, 21.4 million people signed up for healthcare in the Affordable Care Act. And this green at the top are people making more than 400%. So these folks, these folks are getting some subsidies. Next year, they're getting no subsidies unless Congress changes something. So you'll see the biggest group that changed are the people making up to 250% of the federal poverty level. But the numbers have increased in who signed up for this plan. So you can see that Americans are more and more just signing up for this. So any questions so far? Are there any questions, Kathleen, so far?
Nope.
Okay, everything okay?
Yeah.
Everything
Yeah,
clear
I
with what
can
I'm
hear you.
saying?
Yeah.
Okay. So let's look at then, so we've seen some of the numbers. Let's then look at open enrollment and when you can sign up. So for most folks, you'll sign up for during open enrollment to get insurance. So last year, it was November 1st through January 15th for insurance this year. Now, it's not for sure yet, but the current proposal, this is all in the bill that was passed in the House and hasn't gone to the Senate yet. The current proposal for next year is a month less, so November 1st through December 15th. So mark that on your calendar. If you're interested in insurance for next year, you have between November 1st to December 15th next year. Probably that hasn't been passed yet, but it's what they're talking about. So just, keep abreast of what's going on in the news, and so you'll know. And truthfully, last year, most people, a huge percentage of the people that signed up, of that 21 million people, signed up before December 15th. So most of the people did, but there were definitely people that signed up between December 15th and January 15th. So if you need insurance now, if you there are ways to get insurance outside of open enrollment, and that's called special enrollment periods. So these are folks that can still sign up this year. And mostly this is if you have a change in your tax situation, or if you lose your insurance. So I spent a lot of time going to job fairs and reaching out to organizations and companies that have laid people off. Like we've been trying to reach out to folks at Burt Nash here in town. Because if you lose insurance, you can sign up for the marketplace anytime if you lose insurance. So, and all of these are 60 days before and after your life event. So, and often, if you know people losing their job right now, often insurance in the marketplace is much cheaper than Cobra. So, I'm not saying that you should get insurance through the Affordable Care Act, but just do a comparison because a lot of people, Cobra is really expensive, and a lot of people can find insurance at a lower price through the marketplace.
Hey, Heather,
Yeah.
I got a question. So if you lose your job, how do you determine your income? I mean,
Yeah,
what?
it's a good question. So, they believe you right now. That might get a little stronger next year, but right now you put your I'm going to go through a checklist of things you should bring in a couple slides,
Okay,
but you will project your number that you're going to put onto your taxes next year.
okay,
You're going to say, I think I'm going to put down $40,000. If you get a job and you think you're going to make $40,000 a year and you get tax credits for that amount, but you end up getting a job and you end up making $70,000 a year, you can go in and change the amount and it'll alter.
okay.
Yeah, so you can also just get insurance for a little bit. So if you needed insurance for a couple months between jobs, you can go in, get insurance, and then when you find a job, you can stop the
Right.
insurance.
Okay.
So
There's
There's,
another question here in the
yeah,
chat. And a person asked several moments ago, can you visit with navigators in any county, regardless of what county you live in?
sure. Yeah, so just sort of know that the navigators in different counties might be more attuned to what the plans are in their county. So, but they have access. It all goes through the marketplace. So so you're going to put your zip code into the marketplace and it's going to show you the um the plans for that county.
Okay.
So, and you don't have to even go to a navigator. You can just do it yourself from your own home if you feel comfortable doing that. Um, but yeah, so you can go anywhere.
Okay.
So,
Thank you.
um, yeah, so all the rest of this list is a lot of them are changes in insurance or change. So kids who turn 26 are going off their parents' insurance, retirement, so you're losing your insurance through retirement. If you get married, if you have a child, people moving to Kansas, so a change in address you can get into the marketplace then. There's a lot of laws around opening it up for folks in domestic violence situations. If you have, that's pretty detailed. So if you have special questions about that, please contact me. But people who are victims of domestic violence, there's some really good laws that support people getting insurance through here. So people getting out of incarceration, change in immigration status of people who get Social Security numbers, basically. And this last one, people between 100 and 150% of the federal poverty level, those folks can also get in all year round. That's probably going to change next year, but this year, those folks, and that is, again, this is the chart I showed you before, but just smaller. So these people with 100 to 150% of the federal poverty level can get in any time of year. Now, these are the folks that get free insurance. So if this is you, you can call anytime. Um, and all those change of life, you have 60 days before and after. So like 60 days after you retire, you need to have signed up for Affordable Care Act, or 60 days after you lose your job, 60 days after you get married. So you have to do it within that window to be able to qualify for one of these special enrollment periods. So, um, and so then when you get in there, what kind of insurance? I'm going to talk about what kind of insurance you can find. So there's 4 different levels: bronze, silver, gold, and platinum. I tried to make the colors around as good as I could. Um, so you can see it gets as it kind of goes up in colors. So bronze being kind of third place, second place, first place, and like super first place, I guess platinum is. But so bronze has low monthly premiums and high deductibles and copays. Silver, a little bit less monthly premiums and a little less deductibles and copays. So, or more, I'm sorry, higher premiums. And so the premiums go up as the colors go up, and the deductibles go down as the colors go up. But the silver one is the important one to know, because this is the only level that you can have the tax credits or the subsidies in. So those tax credits that I just talked about, you have to get a silver plan to be able to qualify for the tax credits. And what it does, it usually makes them about as affordable as the bronze plan. So if you get the silver plan. So, but you can't get tax credits at gold or platinum or bronze. You have to get the silver plan. So, and when you get into when you get into healthcare.gov and look around, you can search for only silver plans if that's what you want to. Um, so yeah, the premiums go up and the deductibles go down as the colors sort of increase. And so if you're wanting or interested to sign up, I hope I could get back to my slides after I do this. What you're going to need to do to sign up. I have a checklist that the Affordable Care Act puts out for you. Let's see if this works for me. Um, yeah, so here is, and I've sent this link. If anyone needs this link, you can write it off. You can see it at the top here. But also, I've sent it to Kathleen so she can share it with folks. But the Affordable Care Act has a checklist of things you're going to need to have prepared to make it easier for you when you get in there. So you should know things about like your household size, your mailing address for everyone applying for coverage, social security numbers and birth dates. And especially if you're talking to a navigator, you should have all of this ready so your navigation is goes more smoothly. Um, so, the information about how you plan to file your taxes in 2025. Are you filing jointly with someone? You're filing separately. How many dependents are you going to put down there? So all of these things, so this is your question, Kathleen, that you asked, your best estimate of what your household income will be for 2025. So all these things are what you'll need to have when you go in, and that will just make it all more smooth when you sign up. So you're not like looking for pay stubs later and looking for, your son's social security number and all of that. So have those ready. And this is an easily findable form online. So here's the email address. So this is, yeah, anyone can find this online. Let's see. Let's see if I can get back to my slides now. There it is. Okay. Oh, that was easier than I thought. Okay. So now I want to take us into the website. So healthcare.gov is the website address to go to where all of the magic happens. this is a word of warning. These people, healthcare.org, have paid a whole lot of money, and sometimes you can type healthcare.gov and it takes you to healthcare.org. So do not go to healthcare. Do not give them your information. It says, so this is a screenshot, but it says down at the bottom of this, like, there's all sorts of disclaimers that says this is not the marketplace, but it's in very little print at the bottom of this. So I just want to, this happens to people all the time. So
So does it go by either healthcare.com or healthcare.org? Because it's the
That's
URL.
.com.
yeah, so I don't know, I'd sort of forgotten about it until I typed in healthcare.gov and this came up twice
Oh,
for me.
wow.
So it's just one of so just be sure you are on this page is what I want to tell people.
Gotcha.
So this is what healthcare is, it's this nice blue. It says gov right here. So just make sure you're on the right page. There's so much fraud in health insurance, and people are people are trying to get um people are trying to
Yeah.
do things to people. So just make sure you're in the right place. And so here, this Get Marketplace Basics, you can sort of read up more on the marketplace. This is logging in to make changes. So if you have an existing plan, you can go in here to make changes. We're gonna go into this browse plans and costs. So this is sort of just you can you can look around without signing up, basically. Um, so one thing you will have to do when you sign up is you will make a you'll have a password and all of that. You'll make an account that will be yours for as long as you have the health insurance. So um but yeah, but you can browse without making an account. You can just look around. So we're gonna look around and see what happens when we go in. So if you push browse plans, this comes up. So see plans and prices. Are there any questions so far that we're kind of going on to the next thing?
Well, there's a question that popped up. It's not so much on the website. It says, what if your spouse is already on Medicare, but you are not eligible for it yet? Do you still report household income or only your income? Then it goes on to say, we both are retired. I will need health care for 9 months in 2025. I will turn 65 in October 2025.
Yeah, so yeah, if you're filing jointly, yeah, so it's going to be the number you put on your tax form. So it's whatever number you put on your tax form is what your income is. So um yeah, and so it won't be more than 8.5% of your income. You won't pay more. So yeah, so but there's lots of folks like that. The one is on Medicare and one's not ready for Medicare yet. So when you go in, so we're gonna here, let's put in 66046, kind of a good Douglas County zip code. And so then tell us about your household.
So Heather, on
Yeah.
the visual on the slide, it's not taking
It's not
us to where
changing.
that to your screen. It just is still on the front page of healthcare.gov.
Oh, it is? Oh,
Yeah, it's not switching up.
I don't know why that is. Let's
Yeah.
see. Let's see if maybe I need to share a different
Yeah,
page.
maybe you take out the slides and just share the live
Yeah.
website.
How about that? Oh no, that's not the one we
Oh
want
yeah,
though.
there you
Oh,
go. That's it.
we're there. Thank you.
Yeah.
Oh, but that's not the page I wanted. Hold on.
Okay. Yeah.
Um, maybe. Okay.
There you go.
All
There we
right. Can you see it now?
Yeah,
go.
that's great.
Okay, good, good,
Thank you.
good. Okay. Let's see. We don't have a plan ID, so we're gonna skip that. Who's in your household? So let's say it's just you. Continue. And then let's say you're 61 and you're female, and you are not eligible for Medicare, no children under 19, you're not pregnant, not a tobacco user, so none of these. And then you can just push next. And so these are kind of what people, this is like a general price without the credits.
Okay.
So it first takes you to, this is sort of like what the prices are. So these are, um, and so you can see there's 21 bronze, 22 silver, 20 gold plans in the area. So this is a bronze classic standard, and you can filter it for if you want to do just silver, which is the one you can get credits with. So these are full price still. I don't know why it does this. For some reason, it made me do it twice. It makes me do it twice.
Hmm.
Filters. There's a way, and I apologize. I was able to do this the other day. Um, if you put in your, if we could figure out how to put our price in, why am I not able to do this? So dental is not always included. So look at, there's that. Well, I apologize about this.
Someone's saying don't hit skip at the bottom of the page.
Okay. Oh, yeah, that's right. Okay. Confirm. Okay.
There you
So
go.
thank you, whoever told me that. So,
Yes.
Thanks, Linda.
um, so household income, let's say it's going to be, you're going to have $40,000 just sort of, and then continue. Um, So this, based on income and household information you provided, your household may qualify for a premium tax credit of $944 a month. So then you get in to see the plans. So see, they just got a lot cheaper there. So and you can just go around and you can filter out for things like if you have certain things that you know you need help with. So if you have heart disease or asthma or depression, you can filter out for plans that maybe focus more on those types of things. If you have an insurance company you like, or you can filter out for those types of things. So you can see there's 14 Aetnas, Ambetter, Blue Cross Blue Shield 9. So, and sort of says how many different um, 40 most do diabetes treatment. So you can sort of look around and see, and you can add if there's a doctor you like that you want to see, which doctors take which insurance, if there's prescription drugs you're on, which plans cover which prescription drugs. So you can just sort of look around and see what it is. So this, you're not committing to anything yet. You're just getting a good look.
Mhm.
Um,
So how do the tax credits work? I mean, are they deducted like monthly, or is it something at the end of the year you apply them to your
no,
taxes?
this is you pay the monthly fee.
Okay.
So yeah, so it's just like paying a premium every month.
Okay.
So yeah, then, but if you again, if you say you're going to make $40,000 and you end up making $60,000, you might get, they might ask you for money at the end of the year. The first year, I think you do it wrong. They might be a little more lenient. The second, third, fourth year, they are less lenient. That is one of the things that might be changing in the
Mhm.
future. So that sort of leniency, they might be making things less lenient around that. But yeah, so you'll pay a monthly premium every month, and then but there might be some fixing of the premiums if they were wrong during the year.
Okay.
So at the end of the year on your tax bill. And then here's, we're not going to do this, starter update an application here. So if you see something, and then um, you can kind of do it for real. So are there other questions about this?
I mean, would you say it's pretty intuitive if you don't have a navigator? I mean, somebody with basic computer skills can handle this, or is a
I'm
navigator
always
necessary?
I am always real hesitant people's comfort levels are so different. I mean, some people go in and do it no problem, and some people go in and just it's
Yeah.
not happening for them. So it depends. Know yourself, and you can call a navigator and just have someone have another pair of eyes looking at it with you.
Hmm.
If you call someone over the phone, just sort of know that either you or they are going to be you. I guess people can screen share, but our navigator, um, either you're looking at it or they're looking at it because only one person can be logged into your account at a time.
Okay.
So, just to kind of know that they're either going to tell you over the phone what's happening or you're going to tell them what you're seeing. And um, so, depending on if you screen share or not, I guess.
Great.
But you can't be logged in at the same time the navigator's logged in. The navigator also, our navigators and most navigators have language options. So if you know someone who speaks Nepalese or like a more kind of obscure language for this area, we can get language translation for folks too. So we've had people from KU who are international students getting insurance for their spouse and such, and who are from all sorts of countries, and we can get translation assistance for that too. So all that's possible. So
There's
There's
a,
a question, another question just popped up, and this is the person who says you're welcome, who said don't hit the skip button.
yeah, yeah.
To do an estimate of your income to sign up, are you required to include retirement income such as capers, and how about Social Security?
Yeah, so whatever number you're putting on your tax returns next year is what it's based on. So whatever your income is on your tax returns next year. Which is why, like the special enrollment periods, it's usually a change in income. So, like, if you have a child, it's gonna, you're gonna take some, you have your number of household numbers are changing. So, or if you get married and you're combining incomes and the number of your household is changing, or so a lot of those special enrollment periods are around change in your taxes for next year. So.
Thank you.
Other questions? Is this clear to people? Sort of. I mean, really go in. It's so, when I talk to navigators about what do you want, folks to know about, and they always say, it's so unique to every person that until you get in there and put your information in, your income with your zip code with your household size, like it's just look and whatever special circumstances you have, it looks different for every person. So kind of going in there and looking around for yourself is,
Okay.
is what you need to do. So,
I will say, throughout open enrollment, the library usually likes to have navigators on site at the library that you
oh,
can
good.
make an appointment with. So I don't know what this year will bring in terms of the availability of navigators after hearing Heather's story about being doged or cut.
Yeah.
But we're going to do our best to see if we can get people through Heartland or through KU. There's the little study room in the health spot we usually have available for those consultations in person.
Well,
So
I
kind of
see Heartland has one person on staff doing it now, and it looks like they're hiring for another person.
great. So
So
hopefully
hopefully,
we'll have some folks on site, but kind of keep
yeah.
your eyes peeled for that on the library website as that time gets closer.
You know, the other person who I know does it for aging folks, is Jayhawk area on aging in Topeka. There's a navigator there who focuses on information with retired folks. So, I think his last name is Schramm. He's been doing it for a long time.
Great.
He's a retired man who, he's my friend's dad.
Oh,
So, but but yeah, he's been over there. He was a retired person from, I think he was a Hills marketing person or something, and has been helping people in his retirement navigate but he's at the area agency, Jayhawk agency. Was it Jayhawk area for agency?
yeah.
How, yeah, in Topeka. So he might appreciate a phone call over there as well.
Okay.
So, but they do not have people right now. I'm not saying they won't at open enrollment time, but right now they don't have anyone at the Douglas County Senior Center. They have Medicare people, but they don't have anyone um for for the marketplace.
Okay.
So let's see. Am I back to my slides for you?
I think you're still
Um,
online.
Yeah.
Okay. Let me go back to
One last question. How soon does the insurance begin after enrollment
it
coverage?
usually begins the first day of the month after you sign up.
Okay.
So, like during open enrollment, well, so people that sign up from November 1st through December 15th in open enrollment, it starts January 1st. And last year, when open enrollment was also up through February 15th, anyone who signed up between December 15th and February 15th, I'm sorry, anyone who signed up between December 15th and January 15th, it was February 1st. So there were two start dates last year. So I assume this year there's just going to be one start date. So anyone signed between November 1st and December 15th, it should start on January 1st if it goes the same way it did last year. But if you sign up now during a special enrollment period, it'll start the first day of the month
Gotcha.
after you sign up.
Okay.
Am I back to the slides?
I think so, yes.
Okay.
Yes.
Yeah.
All right, so this is, again, through August 26th. This is our website. We have a navigation spot too. Our website is getcoveredkansas.org, and here's all these blue pins are where we have navigators around the state that you can sign up for, if you want to, you can sign up online for most of the clinics if you want to go in. Heartland is not on this one. They've not, but the Topeka one and the Kansas City area ones are on this one, so you can sign up. But if you have family out in Salina or something and you want to sign up out there, you can do that too. So they might be surprised to see you from Lawrence and Salina, but I don't know. So, but and we also have so I was telling Kathleen before we started, there's Cover Kansas is one of two agencies in Kansas that has navigators. The other one is called Thrive Allen County, and they will keep going next year. They're hoping greatly reduce their staff, and they found some outside funding. So this 866 number is our number, and we're hoping to migrate that number over to them. Um, and then but this number is a virtual navigator that you can call anytime. But Thrive Allen County, they've kind of focused down, these are their folks down here, but but these people that have been working for us, these navigators sort of north and west, those organizations will probably become just independent navigation organizations, meaning they work directly with Center for Medicaid and Medicare Services. So, yeah, so they won't have someone in Kansas sort of helping them. They'll go straight to the mothership. So, and then this is back to the healthcare.gov site. So the first time I had this, I had these three choices up. There was one down, find local help. So next year during open enrollment, you can do this. You can go to healthcare.gov and push find local help. And then here, okay, now I'm gonna share this page. So, and then this page will show up. So, and you can push find local help, or you can push get contacted by an agent or broker. Um, if you contact an agent or broker, so agents and brokers are people who make money off of, so our navigators do not get any sort of money for we don't get money for selling people. We're not salespeople. So we say these are your options, and we don't tell people what to choose. Agents and brokers sometimes will get money for selling particular plans. So they have a little bit more of a dog in the fight. Um, and sometimes if you contact an agent or broker, you might get spammed a lot afterwards. So just contact someone you know if it's an agent or broker. I would shy away from just doing a random agent or broker. So um and so if we push find local help, again, you can put in your zip code and it's going to put um so assisters are people who are independent from agents and brokers. So that's what we are. So, and these are people who don't get any kickbacks or any sort of money for, and then agents and brokers, they sell marketplace plans. And some of them are good and some of them are not. So I just, no, please know who you're working with when you're working with an agent or broker. So you can, so here's the list of folks around that you can um, contact for Kansas plans. And then you can make it just assisters or just agent and brokers. So like El Centro has has so these are navigators and different sorts of assisters. So there's the Jayhawk Area Agency on Aging in Topeka. So these are the people. So Grace Med is so they're the federally qualified health center in Topeka that has folks. So a lot of these people are people that work in health clinics.
So just to
So
clarify, you can get assistance both over the phone and also in person, or
it depends on the different clinics how they have it set up. So that's not a one size all fit.
okay.
You can, yeah, so you would just have to talk to them. And then if you look at just agent and brokers, so you'll see some of them are multiple states and like this person is just here. So I will just say that we have a lot of people calling. There's someone in Florida. I don't. And we get lots of phone calls about fraud from a broker in Florida that they've been taken advantage of. So just beware of that. So maybe look around for some local brokers instead of people working in multi-state areas. So.
Is there any like source of you can go to that kind of vets these folks?
Yeah,
I
I don't
mean,
know. That's a good question. I can find that out. I had not heard about that source, but
other than kind of just Googling them and looking at
yeah,
comments or something like
maybe.
that. But
Yeah. So we have so many problems. One of the stories I tell is we had a so the Farm Bureau has a health plan, and if you're a farmer and you get into it, it's a really good health plan, and people are on it for their whole life. But it's not on the marketplace, and so it doesn't take pre-existing conditions. So you can't get into it if you have a pre-existing condition. So we got a call last year from the Farm Bureau because there was a young woman who lived in Donovan County, and she was married and pregnant, and she was turning 26, and she had stayed on her dad's health insurance. And her plan had been to transfer over to the Farm Bureau when she turned 26 to be because her husband was in the Farm Bureau plan. But it turns out being pregnant is a pre-existing condition,
Mm.
so she couldn't get in the Farm Bureau. And so somehow she'd gotten in touch with a broker to get into the marketplace, and she indeed got a plan in the marketplace, but there was not a doctor within 200 miles that plan covered. So we were able to help her. She called us, well, the Farm Bureau called us, and we got in touch with her and were able to get her a plan that worked for her area. But just that, so that's kind of the thing, something that might happen to you with a broker. So it was probably okay health insurance if you lived in that area. So, but yeah, this poor young woman was pregnant with her first baby and was scared. So because she'd gotten signed up for something and there was no doctor
Mhm.
for 200 miles that could help her or
That's pretty
that
rough.
would take that insurance.
That's a long wait for the doctor to get there.
It is, yes, or for her to get to the doctor.
Yeah.
Yeah,
Right.
so that's just one story I tell about like, what might happen. So,
Mhm.
and yeah, so just beware as you're doing this because there's a lot of money to be made for people, and wherever there's a lot of money to be made, there are people that will try to make it. So,
Yeah. There's a question here. Heather, we've heard Aetna may not be a part of the marketplace next year. I wasn't sure if that's accurate and wonder if you know.
those are things we usually find out later in the summer who's in and who's out. So I've heard that rumbling too, but there's been no um yeah, I don't know. So we don't know.
No word yet.
Yeah, no word yet. So
Okay.
and that could just be rumbling. I don't know. So
Hard to know.
yeah.
Any other questions? We have a master answerer here.
I know.
And if you need to get in contact, here's my contact. So this is my email. So, August 26th. So, and then this is our 866 number. This is our virtual navigator. So, who's great. So this is not me. This is my colleague named Jen, and she's been navigating folks for several years, and she's really, really good at what she does. So, if you wanted to have someone just kind of go through some plans with you, please call her, and she'd love to talk to you. She loves people, so she'd love to talk to you. So, and this is our website, getcoveredkansas.org, where you can look to see where our in-person navigators are.
And I
So,
went ahead and put the links in the chat, but
oh, good.
we'll email those out to everybody
Yeah.
as well.
Okay.
I sent them to Laurel. So,
Wonderful.
yeah, just a lot to think about.
It's a lot. Yeah, and that's why boy, if you can find a navigator, I mean, you can definitely go through here and do it yourself. Lots of people do. um, and they get good plans. And I myself, I just like to have a second pair of eyes. So
Mhm.
Me
because
too.
yeah. So if you want a second pair of eyes, maybe buddy up with someone and both look at it and see if you see sight. So just or have your 21-year-old,
Yeah.
in your life who
Yeah.
knows about computers. I don't know. But
That is daunting for
yeah,
someone. And
yeah.
I'm not personally not the guy that likes to do Sudoku.
Okay.
I mean, I'm just not that guy. Some people are Rubik's Cube.
Right.
I can hang in there for really long things, but that's not my thing. And some of this technology, which other people find it as a great challenge, I get anxious.
Mhm.
Yeah. Well, millions of people signed up on their own last year. So millions and millions of people signed up on their own. And once you're signed up, it will renew. You'll
Oh,
get a
perfect.
renewal notice in the mail. So it won't. So, and you can it reminds you that you're signed up. And so you can cancel. But, um, sometimes people forget to cancel. Just remember, like if if you're looking for a job or something and you get a job that has health insurance, just go in and cancel your marketplace insurance. So,
And then
but
as far as stuff like your premium payment and things, I mean, just put that on a credit card or how does
yeah,
that work?
however, yeah, they'll have different
Okay.
ways to pay when you get, that's
Okay.
all part of like,
The process.
yeah, so they've got the payment page. They'll try to get your money, so
Yeah,
they
I'm
will make
sure they
sure.
will.
So, yeah, they don't take IOUs, I don't think so.
Yeah,
Bummer.
show me the money.
That's right.
Yeah,
Yeah.
so
Wonderful.
Great.
Well, how did you ever get just I'm curious, Guy, how did you get started in this?
uh,
I
it was sort of just happenstance. I had a part-time job and I was really sort of looking for a full-time job. My background's I'm a minister and I saw an ad it was the job description was helping folks, most marginalized folks find healthcare. And I thought, well, that is right up my alley, doing health justice work. And so I just applied. And so this kind of, actually, who hired me, Kathleen, is Kate Gramlich.
Oh, gosh.
Yeah,
Former library
a
employee.
library. Yeah.
Yeah,
So she's
that's
sort of an
great.
inspirational young woman.
Yeah.
Sort of took a chance on a pastor who she thought maybe had transferable skills.
Well, I'm glad she did.
So, but who she thought could maybe talk to lots of different kinds of people. So,
Yeah.
but yeah, it was sort of trial by fire. I started day one and just started reading healthcare law, which I'd never really read before. So, but it's, yeah.
Well,
Wow.
you are a rare person.
Oh,
And
well, thank you.
thank you.
I think
And
that's a
thank you
compliment. I'm not sure.
Yes. Here's a thank in the box too. It says, thank you for all this help and thanks to the Lawrence Public Library.
Yeah,
And
yeah, thank you. Well, this is such an important thing
it's
to offer to
huge.
folks. Yeah.
Huge
So,
and such a
mhm.
worry. Another thank you from Vicky Smith to everyone. Um, really, thank you so much for this information. And it kind of makes me think you've got a friend. I mean,
Yeah,
like you've
yeah.
got a navigator. Such a great word because it's
Oh, Jen, who is at the 866 number, she has repeat business. I mean, even when people don't need to like, they can just say yes, renew. They always call her back just because she's so good at it and
oh,
just
wonderful.
to
Well,
like check in every year. So she's got her repeat customers year in, year out. So,
that's magnificent. That's
yeah,
wonderful.
yeah.
That is
So,
Great.
well.
Well,
Thank
we
you
will,
very much for being with us. And Kathleen,
yeah,
do
thank you for the
you want
invitation.
yeah, and we'll post the recording on the YouTube, library's YouTube channel probably
right.
tomorrow. So,
Okay, great.
All right. And we'll get that email address that you said. We'll send that out to the participants,
yeah,
registrants.
I
Okay,
went ahead and
wonderful.
sent you all those links.
Oh,
So,
wonderful. Okay. Well, thank you for being with us and
perfect.
thank you everyone for coming to this special kind of a pop-up program. This was just a talk about timely, very, very timely. And we thank you for your time and thank you for your helping and expertise. And we'll see all of you at the library somewhere soon, I hope. Right?
Yep.
Okay. Thanks for
Great.
being with us, everyone. Bye.
Mhm.